Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on drug classes, mechanisms of action, and side effects, with 4 answer choices and explanations. Drug classes, mechanisms of action, and side effects. Clinical vignettes. 1. Beta blockers. Mechanism of action. A 60-year-old man with hypertension and angina is prescribed Metoprolol. Which of the following best describes its mechanism of action? A. Blocks I1 adrenergic receptors. B. Inhibits angiotensin-converting enzyme. C. Selectively blocks beta-1 adrenergic receptors. D. Directly dilates arterioles. Answer C. Selectively blocks beta-1 adrenergic receptors. Explanation. Metoprolol is a cardioselective B1 blocker that decreases heart rate and myocardial oxygen demand. 2. ACE inhibitors, common side effect. A 55-year-old woman with hypertension is started on lisinopril. 2 weeks later, she develops a persistent dry cough. Which mechanism explains this adverse effect? A. Increased histamine release. B. Accumulation of bradykinin. C. Increased norepinephrine levels. D. Reduced prostaglandin synthesis. B. Accumulation of bradykinin. Explanation. ACE inhibitors block the breakdown of bradykinin, leading to a persistent cough. Calcium channel blockers. Adverse effect. A 70-year-old man with hypertension is prescribed Amlodipine. He returns with bilateral lower extremity swelling. What is the cause of this side effect? A. Increased venous return. B. Increased capillary hydrostatic pressure. C. Direct cardiac depression. D. Reflex tachycardia. Answer. B. Increased capillary hydrostatic pressure. Explanation. Dihydropyridine calcium channel blockers, e.g. Amlodipine, cause vasodilation, leading to peripheral edema due to capillary leakage. 4. Loop diuretics. Electrolyte imbalance. A 62-year-old woman with heart failure is started on Furosemide. She presents with muscle cramps and arrhythmias. Which electrolyte abnormality is most likely responsible? A. Hyperkalemia. B. Hypernatremia. C. Hypokalemia. D. Hypercalcemia. Hypokalemia. Explanation. Loop diuretics inhibit NAK-2Cl transport in the loop of Henle, leading to potassium loss and hypokalemia. 5. Statins. Adverse effect. A 50-year-old man with hyperlipidemia starts Atorvastatin. A month later, he develops muscle pain and weakness. Which enzyme is inhibited by statins? A. HMG-CoA reductase. B. Lipoprotein lipase. C. Acetyl-CoA carboxylase. D. Phospholipase A2. Answer. A. HMG-CoA reductase. Explanation. Statins inhibit HMG-CoA reductase, reducing cholesterol synthesis but increasing the risk of myopathy and rhabdomyolysis. 6. Proton pump inhibitors, drug mechanism. A 45-year-old man with GERD is prescribed Omeprazole. What is its primary mechanism of action? A. Blocks H2 histamine receptors. B. Inhibits H plus K plus ATPase. C. Neutralizes stomach acid. D. Inhibits gastrin release. Answer. B. Inhibits H plus ATPase. Explanation. Proton pump inhibitors, PPIs, like Omeprazole, irreversibly inhibit H plus K plus ATPase in gastric parietal cells, reducing acid secretion. Insulin. Hypoglycemia risk. A 25-year-old man with type 1 diabetes accidentally injects too much insulin Lispro before a meal and experiences sweating, tremors, and confusion. What is the immediate next step? A. Administer glucagon. B. Administer IV fluids. C. Administer oral glucose. D. Administer an alpha-glucosidase inhibitor. Answer. C. Administer oral glucose. Explanation. For mild hypoglycemia, oral glucose should be given immediately. Severe cases require glucagon or IV dextrose. 8. Warfarin, reversal agent. A 70-year-old man on Warfarin for atrial fibrillation presents with intracranial hemorrhage. Which of the following should be administered to rapidly reverse the anticoagulant effect? A. Protamine sulfate. B. Vitamin K. C. Fresh frozen plasma. FFP. D. Aspirin. Answer C. Fresh frozen plasma, FFP. FFP provides clotting factors immediately, while vitamin K takes hours to reverse warfarin's effect. Anti-9. A 28-year-old man is brought to the ER unconscious with pinpoint pupils and respiratory depression after a heroin overdose. Which of the following is the best treatment? A. Flumazenil. B. Atropine C. Naloxone. D. N-acetylcysteine. Explanation. Nexplaxone is a competitive opioid receptor antagonist that rapidly reverses opioid overdose. #10. Acetaminophen toxicity treatment. A 19-year-old woman presents with nausea, vomiting, and right upper quadrant pain after ingesting a large amount of acetaminophen. Which of the following is the best treatment? A. Activated charcoal. B. N-acetylcysteine. C. Sodium bicarbonate vitamin C. Answer: B. N-acetylcysteine. Explanation: N-acetylcysteine replenishes glutathione, which detoxifies NAPQI, the toxic metabolite of acetaminophen. Key takeaways for drug classes and side effects. Beta blockers. Heart rate and myocardial oxygen demand, Metoprolol selective beta-1 blocker. ACE inhibitors can cause cough, bradykinin accumulation, and angioedema. Calcium channel blockers, Amlodipine, cause peripheral edema. Loop diuretics, Furosemide, hypokalemia, ototoxicity. Statins, Atorvastatin, HMG-CoA reductase inhibitors, risk of myopathy. Proton pump inhibitors, Omeprazole, block H++ ATPase, long-term risk of osteoporosis. Insulin overdose, hypoglycemia, treat with oral glucose or glucagon. Warfarin reversal, FFP, immediate, vitamin K, delayed. Opioid overdose, heroin, fentanyl, opioid antagonist. Acetaminophen overdose, N-acetylcysteine replenishes glutathione. Would you like vignettes on a specific drug class?